Well, good morning, everyone. My name is John Donadio. I want to welcome you to our, our fourth virtual workshop. This week, it's on County QPA Emergency Procurement. I am very pleased to have a distinguished panel of County QPA officials who I can tell you, like our other county professionals, just have worked tirelessly throughout, the COVID-19 pandemic. I mean, we were joking before that there were emails flying, 12 o'clock, 1 o'clock at night, 7 days a week on the weekends. And I, again, was just a privilege to be a part of the email, chain and to see how hard, they worked in the name of really just good government and serving the public. It was really an honor and a privilege for me to witness, and I thank them, as a citizen, but also as, with the Association of Counties. It was really just terrific, and the communication that went on between and among the county purchasing officials was just tremendous. I mean, from all the way from Bergen County down to Cumberland County. I mean, just communicating on a regular and consistent basis, and again, it was just terrific in all this tragedy to witness. So before I introduce our panelists, I again want to welcome you, and just a couple of housekeeping things. If you have a question throughout the presentation, please use the Q&A icon on the bottom, not the chat box. Use the Q&A, and we'll make sure to get to your questions as time permits throughout the presentation. And before I introduce our panelists too, I want to take a second to thank our sponsor for this workshop, PKA Tech IT Solutions. So they have a 1-minute video that Angela Wolf is going to queue up for us right now. So thank you, PKA Tech. We very much appreciate your support.
Changing the way you think about your IT strategy to connectivity solutions. There are so many ways that PKA can help your organization be better prepared to operate now and in a post-pandemic world. We work with customers in the private and public sector throughout the country. We've seen firsthand the challenges they're facing as they strive to adapt their environments to what's happening in the world today. Can you relate to any of these challenges and concerns? Whether you're struggling to adapt or just need to be better prepared for the future, PKA is ready to help. With incredibly talented engineers and partnerships with industry leaders like HPE and Aruba, you can rely on us for solutions to help you not only address challenges you're facing now, but also lower costs, improve performance, and mitigate risks. At PKA, we're proud to be a true value-added solution provider that will listen, ask the right questions, and obsess over your success. So, how can we help you? The pandemic won't last forever, but its effects will change how most businesses operate going forward. Reach out to schedule a meeting to discuss how we can ensure your organization will be prepared.
Great, that was terrific. Thank you, PKA. We again very much appreciate your support of the association, and I am now very pleased to introduce our panelists, who have just throughout my tenure as executive director have always been very supportive of me and the association. We reach out to them on a regular basis for advice and counsel on legislation and regulations and directives that affect purchasing and procurement, and they have just always been there for the association. So I appreciate, again, just personally, all three of you being here today and all your hard work and support and commitment to public service over the years. So with that, I will first introduce Mr. Dave DeWoody, who is the Cumberland County Purchasing Agent. He's also president of the County Purchasing New Jersey Association of County Purchasing officials. They meet on a regular basis. Next up is Camden County Purchasing official Anna Marie Wright, who is the former president, right, of the New Jersey Association of County Purchasing Officials. And then I love the background, and I said he's got like a Tony Robbins vibe going on today. Gerald Reiner from the Bergen County Purchasing Official. Again, all three we rely on here at the association a great deal for all your help on various matters. So thank you for being here today, and the floor is yours.
Thank you.
Thank you, John.
Thank you.
Okay, I guess we're going to get started. First, I want to thank David for putting together the PowerPoint that's going to be presented today. David, you want to start us off with the slides?
Yeah, if we can move to the next one, Angela. So obviously, this is who we are. And thank you, John, for the introduction and the kind words, especially on the behalf of the association. I'll touch on that before we end our session today. Angela, you want to move on to the DLGS? So obviously, we, as QPAs, depend a great deal upon our guidance from the division. And we are extremely fortunate to have Michelle Mead, who is a routinely frequent participant in the association. She's certainly a great resource to us and also attends the association meetings, even virtually, as we've had to move to that format, obviously. So the first LFN that really came out was on March 16th, and it was relative to 11-6 with the wavering of the NJBRC, obviously not due until payment, but also and moreover the wavering of the pay to play.
And David, if you mind, I would just want to say that when this whole thing started with the coronavirus, we were all in the middle of bidding out everything and doing everything normally, and then everything just shut down. And that caused a huge problem for us. Our building is still closed. I think David's is still closed and Gerald's is still closed to the public. So it made public procurement very difficult to do. And fortunately, like David said, the state stepped up and gave us guidance on how to do procurements and declaring emergencies.
Yeah, no, and this was absolutely crucial because heading into this, depending on which county you're in, some of us were saw the writing on the walls with the couple weeks ahead of this. I mean, for me, the date 3/14 sticks out the highest because that was actually the date we issued a request for qualifications for vendors that can provide services. Many of these vendors were new vendors, and then there was a lot of vendors that no one ever heard of that only were created within that first quarter of that year. And being able to have the flexibility to be able to contract quickly and have the guidance from the state so that way we didn't have to worry about someone coming back at a Monday morning quarterback situation was crucial.
Angela, next slide, please. So subsequent to that, we had LFN 2020. Well, actually, in 20-06 continued, we had suggestions of cancellation of bid openings. I know that many counties did that. It was also suggested a drop box, a locked drop box. The very challenging thing for us was sorry about that, folks. The NJSA 48-11-23 is still required a public opening. I know we had some conversation with John about that. It was certainly a challenge. And then the electronic procurement codes came along and I think addressed some of those issues. We didn't use that format. We did continue to hold some public openings. Fortunately, as everybody else, I think, we certainly encouraged people not to show up. Well, I shouldn't really say that. We encourage people to send in their documents by a common carrier as opposed to just walking in the door or trying to walk in the door and hand us those documents.
Well, and we also, in Camden County, we use the lock drop box, and we still do. And it works out well that we moved our bid openings to our lobby where the drop box is. We have signs that they can drop the bids in there, but we also do open up the building to vendors for the actual bid opening. We did not do the electronic. I don't know if, Gerald, did you do the electronic or just?
Yeah, so initially what we did is we kind of had tried to adapt to the new normal at first for a couple of bid openings. And what we did, just like we're not able to meet down in Atlantic City for this conference, we did WebEx. And what I did is I had, because the guidance was actually suggesting that you had to have multi-cameras, I would then have to use my cell phone for one camera, and then a webcam on the computer for another camera, and then another one of my employees. So there's only 2 of us in a room. And what would be is that to try to like really make sure that people could see as they're flipping through the documents and everything like that. Subsequently, when we were allowed to go to e-procurement with the emergency rule adoptions that were subsequently also being considered for the permanent rule implementation, what we did is we made a determination that was in our best interest to go forward with a complete, fully digital option, which now we don't have to have anybody into our building at all. And that really has saved us a tremendous amount of time and effort. And it's also helped with collaborating across people who may not be in the same building and same office.
I'm just glad that the state gave us guidance on which way to do it for each individual. You know, it's up to each individual entity to make that decision, whether they want to do virtual or in person.
And clearly, you know, every county's different in their resources and the ability to screen for the public or not screen for the public. So, you know, some of the other counties I know actually continue to do a public opening, but those people had to register with the county ahead of time that they were coming, go through a screening process for temperature and masking and social distancing and what have you. I can tell you that we did have a construction pre-conference that we ended up, the courthouse being shut down, ended up using the huge jury room within the courthouse to hold about 12 people with the social distancing aspect of it. And it had to be done there because it was a construction project relative to the roof, and there was a site visit thereafter. So it has certainly presented some challenges. I mean, I've heard of people holding their openings on the parking lot, and some municipalities, other QPAs I've talked to have actually done it in the lobby of their city hall. So the flexibility is out there depending upon your resources and how you can adapt to complying with still having that public opening in some form or fashion.
The last thing to note on that very specific topic is that if you are holding a bid opening and somewhat in person, it's super extra important now to get every person's name and contact information, because God forbid there's a incident from that particular event. Contact tracing, of course, is, as we know, so valuable when it comes to trying to figure out how far the spread is and trying to nip it in the bud.
Okay, Angela, next slide, please. So subsequent to that, we got additional supplemental emergency procurement guidance from the division. Again, this one was with the addition of the Executive Order 107 on restricting public gatherings. And you know, we all know that number has changed up and down, or according to our current situation in the state. Again, having this guidance was certainly helpful, I think, to everyone, and actually talked about social distancing within the LFN and the use of a potential web conference or live video, and then actually, you know, also giving additional time for bids that we did put out. And I think we want to talk about, well, we can talk about that and perhaps the challenges, but, you know, I know that several people in the state canceled bids or gave it extended times for bids on the recommendation of this LFN.
I think it's important also to note, David, that we just have to be as transparent as possible throughout whatever method we choose, to be as transparent with the public. And I mean, we would get calls and say, are you sure it's open to the public? And be like, yes, you just have to get, like you said, a mask and your temperature taken before you came into the lobby. We also had pre-bids that we held outside and try to do them as much during the summer outside. Now as it gets a little chillier out, we don't know what we're going to do, but for any kind of pre-bid also, so that we could have, like you said, a walkthrough for the projects. I think it's important just to make sure that everybody knows what you're doing.
Okay, Angela, next slide, please. And again, you know, for 2010, you know, asked for, or suggested that we extend bid or RFP submission times, and also tried to encourage the use of people using common carrier, et cetera. Next slide, please. Again, that same LFN indicated, as Anna Marie just mentioned, the retention of transparency, and outlined some steps for the live real-time process with a minimum, I think Gerald mentioned, of posting that low bidder package to a website. Next slide, please. These are, in a nutshell, the e-procurement regs. Gerald, do you want to talk to them?
Yeah, so the e-procurement platform allowed us and opened the door for us to be able to accept, solicit, accept, and do a lot of things digitally now, which really helps with a lot of things, particularly social distancing. We took advantage and were fortunate enough to be one of the CARES Act recipients. So we were able to use that funds as a reasonably necessary expenditure to purchase e-procurement solutions that weren't budgeted yet, but what we were doing is we were considering our options. So we had a couple in the hopper of which ones we want to evaluate. So we not rushed, but we did a as expedited a procurement as possible that we could. And then what that has allowed us to do is be able to have, like I said, we can post bids electronically and then receive them electronically. And it helps with a variety of things. But again, the fundamental reason why we did it was to maintain social distancing. If there is no public to have a public opening, you don't have to worry about the concerns of course, community spread. These rules were emergency adoptions of the rules that were floating around, the draft regulations that were floating around for, I guess, about a year preceding. And there's certain things that you have to go in detail and just make sure that your system can do. One of them is obviously just, again, that transparency aspect. You have to really make sure that it's still a fair and true bid opening, so that way nobody has a competitive advantage over anybody else, and neither does your department. You can't see, like, for example, I cannot see the submissions until the actual digital bid opening, where there's actually a process that we actually live stream where when possible, the whole process of digitally unsealing them. It's very anticlimactic. The bidders are kind of like, it's done in 5 minutes. One of the particular nice things is also too, is that just for time, and in our situation, we have employees that are here every day, and then we have employees that are at home, and then employees that are rotating in and out. So everyone's not there and doesn't necessarily have their desktop or whatever access to them. So when it comes to bid evaluations on straight bids, when it comes to just cost, having a system that can also do the initial calculation for you is really impressive, because that way in a couple of clicks, you can show who the apparent low bidder is. And again, it's very anticlimactic to the vendors and everybody watching, because the whole process, instead of calling things out, there's a check mark that comes up on screen, but each system's a little different.
Okay, thank you. Angela, next slide, please. Gerald, you want to talk to this? Because I think pretty much being Bergen on the front line and receiving that CARES money, although we've certainly all dealt with, you know, FEMA and the reimbursement structure there related to OEM. You just want to talk about your experience with that?
Yeah, so as we mentioned before, I mean, the local public contracts law, under true emergency purchases, you know, the rules are exempted, right, except for quotes. You still want to try to obtain quotes wherever practical. But then when it comes to FEMA did a whole bunch of webinars, and FEMA was really giving out the guidance that 2 CFR 300, or the federal procurement regulations, were going to prevail when it came to a local agency receiving the federal funds, particularly FEMA, or even to a certain degree the CARES Act before that was there. The keys there is that if it's truly still an emergency or an exigency, you still can act the same way as you did on local public contracts law, which means that there isn't really a limit and everything like that. When it gets to those things that are either quasi, not emergency, or particularly or things that you may be able to do procurement, then you have to really make sure that you're following not just the local public contracts law, but then the federal procurement regulations, which if you're able to bid and you're following the local public contracts law, that will follow and abide to the federal regulations. The things you have to adapt in is you have to make sure that not just prevailing wage, but you also have to call out Davis baking. And there's a couple other things in there that you have to really be aware of and be able to include in your specifications or your documents, so that way it's all inclusive. Then the next part was the OSC. And there's a couple different things. When we received CARES Act money, we have to report to the federal Office of Inspector General of the U.S. Treasury Department. And we have to do a report of a minimum every contract that's $50,000 or more. And we also have to make sure that any vendor who has a contract of $50,000 or more, we have to report into the SAM federal, SAM is System of Awards Management System, into the system. And then on top of that, we had subsequent regulation which required the OSC, the Office of State Comptroller, to also take a look at that same report that we're sending to the Treasury. So it's this double check and double layers. And right now, there's just so much data. I think there's going to be a lag of at least a year or so before anybody really comes out to results of what the audits may look like. But it's constantly changing. That's really the last thing to really say about that. And then, John, do we want to take that question?
Yeah, Gerald, I don't know if you can see it as well, but it's from Ann Hartwick, and is asking about the e-procurement platform and whether or not you still allow for bids to be submitted the old-fashioned way by paper.
Correct. So, and to that question, what it is that it does give you the option to do a hybrid where you can actually still allow them to do paper. We felt that was going to be confusing and onerous, and also potential for a simple mistake which could lead to that lack of transparency. So we chose to do it 100% digital. Many of the vendors have actually came back and said that they prefer that option. The only thing that's there that's kind of ambiguous is that, and this was based on legal counsel, when we do a construction job, what we do is we do have the option that a vendor who is submitting a construction bid for things like a check, if they want to do a certified check versus a bid bond can be scanned in digital, no problem. But a certified check, if they want to do that, according to our counsel, they still have that option. We can't deny them that right if that's how they want to post the bond requirement. So they would have to send that in by time of bid, but that's the only document that would be, that's kind of like a hybrid.
Did you have that issue, Gerald, at all? With somebody
No one's done that, but what we do is we put it in our notice of bidders and we leave it as an option. We just feel with the particular case law that's out there, you know, because that gets into the fact that where some agencies will want to demand just a check, or some agencies will want to demand the bid bond, but in the eyes of the law, they're the same. So we just wanted to be extra safe. Now we feel that most people are probably going to just take advantage of the bond,
Right.
but you know, having that option until that's clarified, that's just the way we're handling it.
We didn't have time to put this into the PowerPoint, but I just wanted to show you, this is actually the cover page for the document that we're referencing, the COVID-19 compliance plan for August 2020. It is available online. All the New Jersey Association of Purchasing Officials have this document. It was sent to them yesterday after another meeting. So if you need this or to review it, just ask your purchasing agent.
One last thing when it comes to the OSC is that I would say is that, I mean, some counties take this, or some local agencies, I should say, probably not the counties, because the counties are more likely to encounter the OSC. But for anybody that may be listening who may not be from a county or maybe from an authority or something like that, the OSC isn't trying to really get you, right? I mean, one of the things is that when it comes down to is that if you're not sure, I've always found that you can pick up the phone and have a conversation with them and they'll help you do it right. They're not trying to, they don't want to really find problems, right? Like they're there to observe and everything like that, but they do give constructive criticism that also helps you adapt. So that way, yes, you may get dinged on a particular comment or something like that, but then the next time, it's just like your local audit. You can fix it and you can adapt and then get it right the next time. So don't be afraid of them.
Gerald, one last thing on that. Do you want to speak to that rider document? I mean, we didn't share that, but I know you had correspondence with them.
Correct. So one of the things, and this came out of the FEMA guidance. So the ambiguity when it comes to the CARES Act dollars versus FEMA dollars. With FEMA dollars, there were specific rules and regulations when it came to subgrantees and how they were spending the funds. And therefore, certain things transferred over, Davis baking, some contracts, Section 3, so on and so forth. When it comes to the United States Department of Treasury, is that in general, they've never really given a grant to anyone. They really are just, you know, the bank of the United States government. So they had no local procurement regulations and everything like that. So what the OSC has come out with, and what we'll do is we'll ask John if there's a way to circulate it, is that they're suggesting that there's a rider that needs to be adapted into your contracts and referenced into many of your purchase orders. And that rider has all those things, those federal regulations. Now, those things would only come into play for non-extingency procurements, right? So if it's an emergency, you still don't need that rider. But if it's things where you're able to bid under this CARES Act dollars and so on like that, you may need this rider depending on the procurement you're doing. And you know, the struggle that we have with counties, particularly with direct recipients of the CARES Act dollars, and Dave, you're gonna see this as a subrecipient, I presume, is that the money has to be spent by 12/30, not
Right.
encumbered, right? A lot of our programs and grant programs allow us the flexibility of being able to encumber funds by a particular date. With the guidance that we currently have, it appears that there will be no flexibility, and that by 12/30/2020, we had to spend $162 million, which for a fiscally responsible county is very difficult. In fact, sometimes it's been frustrating because we'll overanalyze, we'll say, oh, that particular X is too much. But that's important to also question because you're also looking for reasonableness when it comes to these funding. FEMA and OSC, FEMA and CARES Act money, one of the key components is reasonableness. Yes, that person may have an N95 mask at $8, but unless you absolutely need it right then and there, paying the $8 may not be a reasonable cost. Now, again, each local agency is going to be different, but it's about having the backup documentation to justify. And one of the things we've done in order to implement a process that makes it a little bit easier, or we feel it's going to be easier, is every procurement that's processed under FEMA or the CARES Act ever since roughly around May of 2020, there's a separate page that we have filled out, which is a simple justification, you know, where there's a couple of there's accountability of who's making the request. There's a couple of check marks of just defining the equipment or the particular purchase. And then there's an open-ended that the question that we're looking for people to respond to is, this item is required and reasonably necessary due to COVID-19. And that's a specific line, reasonably necessary for COVID-19, and then the explanation, right? And then we have a team of 4 people in the administration than myself that review each one to really make sure it jives. So that way we feel comfortable. So God forbid, 5 years from now, it's not necessarily the next week or next month, it's 5 years from now, the OSC or the OIG comes back and says, why did you do this particular purchase?
And
So-
Gerald, what we did in Camden County also is we put every emergency purchase or COVID money on our agenda, a monthly report that we put as a resolution, so that we're transparent, that the public knows what we spent on PPE, what we spent on to fix up our storage areas, so that no one can ever say we did something or hid something from the public. So every month we do a resolution for emergency procurements and procurements for COVID, so that everybody knows what we're doing.
Yeah, and one of the ones you said right there with fixing up our storage facilities, right? That's one of those ones where you're making a capital upgrade or enhancement to your facility, but you're doing it as reasonably necessary to COVID. We're also doing the same thing. We took 3 cold storage garages, we're adding heat and insulation because that's where we're hiding our, not hiding, that's where we have some of our 90-day stockpile. Right. So we're also helping to support a hospital where we're building another facility just because the amount of PPE that may be needed. And let me be very clear is that every piece of PPE, it's never my intention or desire to ever use it. But unfortunately, you need it. God forbid you do.
Right.
Okay, let's move on, Angela, to the next slide, please. I think we could all talk to this issue I know here very early on, a decision was made by CFO and our budget officer to create a specific GL code for COVID-related expenditures. The sweet part of that being that on Edmunds, you can extrapolate that information, export that on the spreadsheet, monitor it on a real-time basis as purchase orders are created in the system. And I think that from the standpoint, them both being auditors in the past at some point, understand the importance of being able to track these expenditures for anyone who is going to be interested in looking at that data. Anna Marie, you want to speak to yours?
Yeah, we did the same thing. We did a commodity code for our PPE for any emergency so that we can do that report monthly for the freeholder meeting. So it's just easy to just run the report for the commodity code. And it will show you every emergency purchase and purchase that we did through this funding. So it makes it a lot easier.
Yeah, we had the,
Anyone can do that. It doesn't mean just county. Anyone can do it that way.
yeah, and when I talk to some local agencies, when we tell them that, they're like, "Oh, I wish we did that because it would have made XYZ reporting that much easier." It was extremely helpful when we were going through with FEMA with our initial reimbursement. We've got several $1 million back within a month in the early on, which is crucial. We kind of went through waves, right? So first it was tying everything to the commodity code, and because again, we weren't sure of the size, scale, and everything like that. But as it came, then we got the guidance that said we could use our storm recovery trust, and then that was the account. And then finally, what we did is we set up a FEMA reimbursement and a CARES Act reimbursement trust or a grant account.
Angela, next slide, please. Okay, we get into some really good, interesting issues here. I guess maybe we should really, I mean, as far as we've kind of covered the fact that, you know, for the vast majority of us, the public has not had access to our county buildings for a certain amount of time, or if they are now able to come in, it's on a very limited basis with screening procedures. I know a lot of us were buying equipment to monitor temperatures. You know, there's a lot of policies and procedures in place. We talked about conducting bid openings. I know that Anna Marie, you want to just briefly mention what you did on the extensions, because I know you did some.
Right, we had to cancel some. We also, you just did an addendum and stretched out the bid opening date until we could figure out how to actually open them. Also, like you said about the sourcing of the PPE, that was probably the most challenging for all of us. And thank goodness we have a network of purchasing agents that we can rely on. I don't know how many emails back and forth between the county folks about where can you find PPE, where can you find a vendor that's not going to gouge you. In March and April, it was very difficult to find PPE, masks, gloves, anything, and the prices of which were out the window here. But I thank Gerald and David and all of my county purchasing officials for helping us to find the necessary PPE at that critical time. And it's still a little difficult, I would say, David, to get PPE and to coordinate that with their OEM. Mm-hmm.
Gerald, your thoughts on that?
Yeah, I mean, that undoubtedly is going to be the most the story that we write, right? That's going to be the story that we tell for generations. And, you know, it's the thing that I, you know, knock on whatever fake wood I have in my office. I truly hope it's a once in career situation. It's right now, it's kind of like salt, right? You don't buy salt in the middle of the winter. You buy it when it's warm. And that's the thing, is that people have to realize is that you really have to build those stockpiles so that way you're not put out. We have the flexibility of a very large and generous snow removal trust, and I was on the phone with I mean, there was days I don't think I slept, but I was on the phone with the county executive almost on a daily basis. And when it came to buying these things, we were very fortunate that we did place a very, very large order with 3M. and we got as close to 3M as we could. Now we had
Yeah.
trouble, and what happened is that we ended up going through our federal representatives and going to them and saying, hey, what's going on with 3M? Because we're hearing about all this fraud and everything like that. We weren't getting what we felt was a active response. So we ended up working through their lobbyist in DC, who connected us with a vendor in New Jersey who was one of the largest distributors for 3M products, and they placed a $1.2 million order. And to this day, I haven't gotten every mask that I ordered, but we got enough. We got enough to get by. Now there's a little bit of a silver lining. I don't think Tony DeNova's on this call, but right in Paterson, New Jersey, there's a company now called Protective Health Gear that manufactures N95 masks, NEOSH N95 masks right here in New Jersey. We were able to negotiate and buy 110,000 for our hospital strategic supply because they were right here. I mean, it was so great, and having that feeling that they weren't going to get caught up in customs. We didn't have to worry about trying to, sometimes it meant we paid a translator to actually translate what was on the box when it came in, or the documentation. I mean, we've all seen documentation. And then the last thing really came down to is that I have a new hated phrase. My first hated phrase used to be, but so-and-so did it this way. Now the phrase that I hate the most is, so I know a guy, or I have a friend.
I have a friend, that's right.
Steve
I have a
Fulop
friend, you
said
gotta
it best.
investigate, yeah.
Yeah, Steve Fulop very publicly went out and did that. And I don't care. I don't care who your friend is. I don't care whatever. Because I spent a lot of time, and they were getting referred. And some of the meetings involved, unfortunately, taking calls at 3 o'clock in the morning because of the time difference. And it was, in all honesty, as a human being, I mean, there was times from working from home, that I had to lock myself in a room to just let it all out, because the stress of knowing that the PPE you cannot procure today. I mean, the wins were great, right? You got the wins, that was right. But when you were doing things like ventilators and negotiating ventilators, which the learning curve was insurmountable, right? I had to learn about ventilators, I had to learn about different kinds of masks, I had to look at EPA documents and chemicals and everything like that. The
Testing.
stress just got to me to the point where I had to lock myself in a room to just literally cry as a full-grown adult, just to let some of that stress out and hide it from my kids. Because the last thing I wanted to do is show the fear that I was feeling to them.
Yeah, I don't think there's any question, Gerald, that you guys were the front line, and we all learned a lot. And I mean, the situation for a lot of the counties down in the central southern was that when it hit up there, we had time, or a little more time, to prepare. But I want to make a couple of quick comments. One about the association, and I'm extremely proud of the membership of the association and to be its chair. And I just have to tell you, there was definitely an esprit de corps. The association members, all through this pandemic, have been very cooperative and networking. And when I tell you, as Gerald and Anna Marie both mentioned, that the email chains were flying every single day. Hey, I need this. Where can I find that? And not pay $14.95 for an N95 mask. And there are people that were out there that doing that. I mean, the other part of it was the fraud that we saw out there, the potential fraud. I mean, we all take our jobs very responsibly, and we're looking to achieve a quality product at the right price. The marketplace was crazy, and it still is to some degree. But we had vendors coming out of the woodwork that we've never even heard of before. I mean, we found situations where product was being purchased and coming into this country, and it was of an inferior quality, or some guy in some town had a warehouse full of stuff and actually was offering it to sell it to states, counties, hospitals here, and if the high bidder was overseas, they would ship it there, despite what the government was telling us. Interesting thing on 3M, I will mention that we did try and put an order in with 3M, not for millions of dollars of masks, obviously at the time we didn't have the need, but I mean, the situation was such that we ordered the masks, and we were told probably about 6 weeks later that 3M was not able to honor our order. And the reason being is that all the masks were going to, as they said, the military or the federal government. And so they wouldn't even ship them to us.
I never got mine, what I ordered, David. We canceled the order because we never we had to go to a different source.
Right. We ended up, in fact, getting a partial order that we never anticipated receiving, but we did. And thankfully, it came at a very good time to support our health department operations and the testing that they were doing. But again, I mean, the marketplace is crazy, and it still is today to some degree. And if we get a major second wave, and I think everybody's seeing upticks in cases, you know, there's going to be supply issues down the road. I think that one of the important things for people to understand in the marketplace is that, you know, the vast majority of medical supplies that we have here are not made here. I mean, it's no secret that gloves, for example, have been made in Singapore, Malaysia, you know, Thailand, some of the other Asian countries for a very long time. They're not really made here. There are very few manufacturers that would make them in the United States. So, you know,
I think that's exactly it. Is that what we really had in this emergency was a logistics breakdown, and it really came down to is that where it was sourced, and even the company in Patterson, their supply still comes from China because melt-blown plastic is not the prettiest thing to build, and a lot of people don't want it built in the United States. And then some of these companies now too, is that they were waiting for, there was one in Texas that also does PPE. Before they ramped up, they were waiting for the federal government or some state entity to give them a long-term contract that extended beyond the exigency. Because in H1N1, what happened is this particular company ramped up, helped everybody, but then what happened is that the orders just got canceled because they were producing masks at $3 a piece. As soon as the supply chains opened up again and they can get those masks for 98 cents a piece, the hospital switched to just-in-time inventory based on those costs because they didn't need this surge capacity. I think that, and I really hope that one of the things that may help us is if the hospital groups and the regulators of the state come up with better numbers of what really should be in reserves based on this, because while I hope that this size incident is the last of my career, it won't be the last incident in general where we will need these particular items. I mean, respiratory illnesses with the age of our population, New Jersey's almost at like, you know, over under with more older individuals than younger individuals. We'll see what the census comes in. And then the other thing to mention is that, you know, this is only my personal comment, is that I found it very, very frustrating that the front office would do a press conference and say that we're working with the counties and we're doing this and we're doing that, and only to then call up our OEM director to kind of get the answer that wasn't 100% true. And the information wasn't flowing. And the problem is that they would say that they had these supplies and we were waiting for the supplies and we couldn't rely on someone else to bail us out. It was an unfortunate situation where it just didn't feel like there was a true coordinated effort. There's a lot of days that we just wanted, like, you know, the state to say, this is what we're doing and this is what you're going to get. But the inconsistency was very hard to manage.
I think on that note, we can briefly touch on the coordination aspects with county OEM or your county health department. I know, at least as far as Carmel is concerned, have a very frequent contact with the folks at OEM, trying to find out what are their needs, because state OEM was looking for the counties to try and source the materials early on before they could supply them. Ultimately, they did supply some supplies, thankfully. And then the county health department folks on the front line, being consumers, I know we had a lot of difficulty trying to get items like isolation gowns for them. They were actually using the equivalent of a full rain suit, if you will, before we could get isolation gowns. And they did have the N95s and other PPE that we were able to get for them. But I mean, these are our frontline folks, you know, right on the testing. And so the coordination, if I'm sure that all the county PAs have had that with their OEM or their health department respectively. And that's part of the teamwork aspect of addressing this issue.
True.
Angela, next slide. Okay, Gerald, I think you can speak to this. I know Anna Marie, you can as well. You want to go ahead?
Yeah, so operational challenges, right? We had a couple different things. One was first the civil service guidance that came out that said that people could take leaves if they were a vulnerable population, pre-existing conditions, so on and so forth. So those are people that were allowed to go out, and we had to then evaluate and scale. And it wasn't, you just had to figure out what processes had to continue on a specific basis. At the same time that PPE was drying up, things like web cameras, laptops, all the equipment that you needed in order to have someone really fully work remote was also stalled and very hard to get to. So you had to prioritize which staff members you had to adapt to. I think the good thing is that on the county level, at least, all of us generally have a centralized procurement system, and many of us have a good digital system. So our system was able to adapt where I could do the workflows of the daily purchase orders. The only thing that had to happen is someone physically had to come in to actually print the purchase orders and put the ones in the mail that weren't being emailed. But you had to, again, prioritize based on what was really the most important. Those contracts that were directly related to the response, those are the ones I was going to prioritize first. Now we're at the point where it's balanced out, where many of our employees actually can get their desktop phones at their laptops. And we've gotten everybody this lovely, Tony Robbins headset, as John would call it, in order to really make that easier and more palatable. And we're just trying to adapt as best as we can, because realistically, the other thing too is that with schools being infrequent and everything like that, with those of us with young children, you can't leave, a second grader at home. You can't leave a first grader at home by themselves. It doesn't work. And then the challenge is like, to go around and do the brain drain of like, suspending people or whatever, does not have them available. I'd rather be more flexible. So a lot of us have really adapted more flexible times. So the thing is that those hours of 8:30 to 4 or 8:30 to 5, whatever you may be, are not the same hours that we're working now. And, it's really about, I need them to be available so I can reach them. They're my staff during the day, but in reality, many of them work, what they'll do is during the hours with the school, they're trying to help their children. And then what they're doing is then they're splitting, and then they're working sometimes to 8 or 9 at night in order to really help out, make sure that all the work is getting done.
Anna Marie, I know that you worked
It was very
several
difficult.
times.
Yeah, it was very difficult in the beginning. My staff all worked from home, but I still came in, like Gerald said, you still physically have to do a lot of things as purchasing, getting the purchase orders out. It was a barren staff. There was an attorney up here that still came in, and my IT director, but that was it in the beginning. And it was very difficult. And my staff said it was very difficult to work from home. Of course, like Gerald said, laptops were hard to get. 8 months later, it's a lot better. We have, the county was allowing people to work from home still, which was great. We all came back from the summer, and then when school started, the county said that as long as you're in 2 days a week, the other days you can work from home as long as you have Go to My PC or whatever was set up for the individuals. But it is difficult for my staff to work from home still. I don't know what that was like. I was in every day, and I'm kind of glad I got to come in every day. I don't know if I could work from home with children and husband, and it was a lot better just to come in and to physically get the work done.
I'll mirror some of that. I know working from home was somewhat of a challenge. I felt that I didn't have all the resources I could have had, only because they're here in my office. But regardless, I mean, the IT folks did a great job in setting us up to work remotely. We were in a situation where actually our building was shut down for a couple of weeks. The contingency plans of staffing were put into place by CFO and budget officer. We went through that, and we were working every other day for a while, in and out, and rotating, actually splitting the staff for the very prudent reason that if Team A got COVID, Team B was still able to keep the process moving. And that worked out very thankfully. And fortunately, I can tell you that, we had coworkers in the county who did contract it, and thankfully all of those people have successfully beat it. I just want to make a quick observation. We're going to get into questions very soon here. And that's basically, as our friend and mentor, Joe Valente, would say, we have to give a shout out. And I think on this one, I would be remiss if I didn't give a shout out to the CFOs out there. I know that the fact of the matter is that we can't encumber what we don't have. So, from a funding standpoint, I know in our particular case, I had a discussion with Jerry Sineski, and he explained to me that, after Superstorm Sandy hit, the writing was on the wall, and he certainly prepared for disaster. We certainly wouldn't have thought it would be a pandemic, perhaps another giant hurricane, but certainly not a pandemic. And being one of the counties that didn't originally get CARES money up front, it made all the difference in the world. So for the CFOs out there who are doing their what I'll call tactical strategic planning in regard to surplus, there is a rainy day fund, and thank God we have it, because that didn't happen by accident. So again, we can source all day, and we can get every co-op contract and everything we can do and talk to one another, but if we don't have the funds, it doesn't make a difference. So a shout out on that, and that's not to take away from Jerry's presentation next week on the 28th with 10 a.m. with some other individuals who can talk to that point. Before we get into questions real quick, I do want to let people know, and this only came to us yesterday at 3 o'clock in the afternoon. This is Assembly 4461. So that if you have a county vocational school, or I believe it also is county colleges, although that didn't particularly jump out at me. This legislation basically is for the state to award a contract for the purchase of COVID-19 related goods and services by school districts. The goods and services would include medical supplies and devices, among other things. So the state may award obviously multiple contracts, and the school districts would be permitted to purchase the goods and services under the contract. And under this bill, the commissioner of the Department of Education would be required to coordinate the purchase and goods and services by the school districts. This would be a bill that would expire July 1st of 2022. It's already passed the Assembly on August 27th by 7700. And ironically, this bill is up today at the Senate Budget and Appropriations Committee hearing at 1 p.m. in registration form. So that's Assembly 4461. We didn't have time to put it into the PowerPoint. It just became available to us yesterday. So something you may want to follow if you have a county college or county vo-tech school. And I guess at this point, Anna Marie, Gerald, do you have any other comments before we open for questions? Because we're about 6 minutes out.
I'm good.
Okay. John?
I do have one question already that was sent to me earlier, and it has to do with emergency purchase of food supplies, and how can we, an employee, avoid using their credit card or their own money, to purchase, out-of-pocket expenses during an emergency. So any thoughts on that would be greatly appreciated.
So based on the question, it sounds to me it's probably food related to a testing site or something like that. What I would say is that even in this chaotic time, there's always a way to find a vendor that can take a purchase order. And what you do is just plan a little bit more, take a half hour to just think about what are our needs going to be for the next week. I'm not saying none of us can plan out a month at this time, but maybe it's a week, maybe it's something like that. Unless it's really a true emergency where you absolutely need it right then and there. And again, I think that's going to be a very limited basis. They probably can use a purchase order. If the county doesn't already, they can contemplate or consider implementing a purchase card. So at least then it's tied to the county and everything like that, because one of the issues you get into is not just the logistics of reimbursement. Was it submitted, especially for things that may be FEMA reimbursable, is that the taxability. So then you have to worry about sales tax and everything like that. You're only exempt when the county itself is paying directly, versus when you're reimbursing the employee, they're not always exempt. So I would just say is try to plan or anything like that. If there's a specific detail that the particular person needed, I mean, we're always available. I mean, we kind of avail ourselves to the state sometimes to to answer questions. I know at least I do, and many of us may be regional, but that's how I would address it.
And I would say that being a county that has P cards, and it's on a very restrictive basis, there were times when we did have to pay a vendor with the use of a P card. Having the system established already made a big difference. We were able to have that as an ACE card, if you will, to act on getting supplies perhaps more promptly because of the payment terms. But yeah, I would definitely investigate the P card as well.
Thank you. We have another question concerning, and I think you touched on this a little bit, so maybe we can reiterate. How are you handling bid openings with the county facilities being closed? Particularly now if you're doing them maybe outside, and if not, I mean, how do you plan on handling that moving forward in the winter months if, the county doesn't open its facility, to the public? And I know that we're still waiting for guidance from the state on the reopening of state and county and municipal facilities, despite the fact that, some counties have already been open, but, it hasn't been forthcoming yet. So any thoughts on that?
Yeah, our building is closed, but we let the bidders in when it's the bid opening. I just let security know that I have a bid opening, and they wait outside, and then they are allowed to come in to get their temperature checked. And we have a table set up down in our lobby, and everybody stands on their own little circle so that we're distant. And we open the bid. If anybody wants to see anything, we let anybody, make an appointment to come back, and we can certainly give them a copy or the results there that they can look through. So even though our building is closed, we still let bidders in for our bid openings.
Gerald's got the E-system, so I think it's kind of moot perhaps for him. For us, the same deal. Technically the buildings are closed, but the people who are interested or perhaps bringing a bid in person, and it has happened, we're doing the same thing: social distancing, temperature, mask requirements for them to enter the building. And I will say it's few and far between, but you will see people, especially with construction bids, want to be present.
Right.
Great. And I have one more question, and I'm going to try to frame this correctly. And if I don't, please forgive me. So can you talk a little bit more about when purchasing goods and services, in light of a FEMA grant, do you need to comply with federal procurement regulations or state, local public contracts law, or both? Or does one trump the other?
So the answer is both. What it comes down to is the general rule of thumb is whatever's more restrictive is what you'd follow. For the contingencies, you just want to make sure that you have your backup and you take care of what you can to really justify what you're doing. The federal thresholds are different from the state, right? I wish, as the County of Bergen and Camden, I wish we could have the bid threshold that's the same as the federal micro bid threshold. It's a lot more flexibility, but our bid threshold is still at 44,000 if you just did the recent resolution. So you still have to kind of like narrow the two. What you're doing though is that in part of that more restrictive principle is that you're supplementing and adding things. Again, when it's federal money, you have to make sure that they're at the Davis-Bacon schedule. And most of New Jersey's 21 counties, the Davis-Bacon schedule matches the New Jersey DOL schedule. Although in Warren County and Sussex County, it gets a little iffy. Sometimes the Davis-Bacon schedule can be higher or lower, and you just have to make sure that you're abiding to that.
Okay, very good. Thank you. I see we don't have any other questions. So any last chance for comments from our panel?
No.
I would just say to everyone, that this is very real, obviously. And please stay safe and follow what you need to do out there, just so that we can all go to NJAC next year.
Yeah, I like that. That's a great idea and a great way to end this workshop. Listen, I want to thank everyone for participating. I want to thank PKA Tech IT Solutions for their support. And most importantly, I want to thank David and Anna Marie and Gerald for their help today and also for all their hard work over the years, especially in 2020. So thank you, and I hope to see you too in May of 2021, and definitely next week for another workshop on fiscal operations. So thank you, and have a great day.
So.
And